What's it like right now in the labor and delivery suites?
So right now we are allowing only one visitor, and it's a designated visitor, and they get a wristband so that they can come in. If it is a possible COVID patient, that visitor is asked not to leave to help not spread the infection. But it is heartbreaking to see families not being able to be there for the birth of their loved ones.
Yeah. Now, this is a situation where, and I know that there are hospitals that are requiring no visitors and mothers to give birth alone. Um, if they're positive, what do you think about that? I mean, so much of this emotionally, mentally, and emotionally is a shared experience, but then the physical demands that the mother goes through, and there's been all this training that they've gone through with their birthing partner, and all. Then all of a sudden, they're having to do it alone. What in the world is that going to be like?
It's heartbreaking. It's already heartbreaking even with one visitor, but I know hospitals in the area are not allowing some visitors at all. And it's just so difficult to see, and we try our best as nurses to be there for them, to um, help them FaceTime, to help them use social media to get some of that support, but it's just still not the same.
Right. And
It's
now,
really
if we have mothers with COVID and they give birth, what's the policy with the newborn and the mother? I know this is such an important time of bonding and the physical bond between the mother and the baby. What's happening if the mother is positive?
Of course, Dr. Phil. Every hospital has different guidelines and policies according to that. My hospital is recommending isolation of the mother and the newborn. Um, of course, the mother always has a choice to refuse because they might want to be with their newborn, and then we try to put at least 6 feet distance between them to help to slow to not transmit this virus, help them wear masks, help make sure that they know how to wash hands properly, how to do all of those things, because it is very difficult. But right now we are recommending isolating the newborn and the mom after delivery in my hospital.
Right. And how about breastfeeding? How is that being handled? And is it true that there's no evidence of transmission through breastfeeding?
So the CDC put out some guidelines, and the SARS virus wasn't transmitted through breast milk. And there's very limited studies right now that's saying that COVID is not transmitted through breast milk, but it's very limited studies. Um, UCSD is putting out a wonderful research to help figure that out right now. So if the mother chooses to breastfeed, we suggest to do expressed milk. Um, and then if she wants to breastfeed at the breast, we make sure that she's wearing a mask, that she washes her hands, that she washes her chest to help prevent that exposure to the newborn.
There are a lot of mothers at home right now with newborns. What precautions would you tell them to take with that newborn right now? How can they maximize safety?
Stay at home. Don't go out. Don't expose this newborn to anybody else. That is the number one thing, to make sure that that newborn, because the newborns, they have no immune system. They are born with
Right.
no immune system. So the least amount of exposure is the best for a newborn. So if everybody can stay home or stay away from that newborn if they possibly can, except the caregiver, that is probably the best.